Hello everyone, hope you had a good lunch and thank you Eric for opening this afternoon so greatly. Today I'm joined by three country representatives. Let's say we're talking about Europe, we're talking about France today, we're talking about the world. And I want to deeply thank Emilie, Jukka and Randu for being with us today and to share their insight about something that can be considered as a burden sometimes, but that is important also to deal with, regulation. And most specifically, data and AI regulation. So the goal of this roundtable will be to have a cross looks of different EU members, so Finland, Norway and France, on how inside our different ecosystem we adopt these different European regulation on data and AI. How do we engage healthcare professionals, patients, and all the people within this to have explainability and a regulation that can engage everyone for innovation? So let's start maybe with a little overview because we're talking about regulations in general. But I wanted to have Emilie maybe have an overview of what's existing already in Europe as regulation.
Thank you, Sébastien. Hello, everybody. I'm really happy to be here. And unfortunately, I have to talk to you about regulation within 3 minutes, so I will be very quick. First, maybe I'm sure you're all aware of the importance of data and of sharing data to encourage innovation, of course. And for example, it's not possible to have performant AI tools without enough data to train those AI tools. And of course, Europe and European Commission is very aware of this topic, and that's why the European Commission has launched in 2020 a European strategy for data. And this strategy encompasses several measures and some legislative measures that are dealing with data governance, data access, and data reuse. That's why we have now several regulations that are applicable to data, and it's not always very easy to understand the articulation between them, for example. So maybe just a few examples. You have the Data Governance Act, which is regulating the reuse, encouraging reuse of data by public bodies. You have the Data Act, which is encouraging reuse between industry. You have, of course, the AI Act that we have already, you all already talked this morning, I'm sure, which is quite a general regulation applicable to any tool, whatever the sector is concerned. It's really important to say that, to understand what I'm going to talk just after. And the AI Act is a risk-based regulation which defines all and classified all the AI tools with by 4 levels of risk. An acceptable risk. First, such tools are prohibited, of course, and after that you have high risk, limited risk, and minimal risk, and several obligations are related depending on the level of risk, of course. So those regulations are general ones, applicable to any sector, any activity. And within the European strategy, the European Commission thought it was also very useful to have some sectorial regulations dealing with some areas of activities. And so European Commission is starting to create European data spaces. And the first data space that is created is the European Health data space, which will be applicable starting in February or March 2025. So it has been adopted, but not yet really came into force. But we already know that he will be a real game changer for the reuse of electronic health data, and a very important element to encourage the development of AI tools, for example. This regulation has three main objectives. First is empowering individuals to take control over their health data, and at the same time facilitating the exchange of data by secure means over Europe and between several member states. This regulation also aims to create a single market for electronic health record systems, and of course it provides a consistent, trustworthy and efficient system for reusing health data for research, for innovation, for policy making, and of course for training of AI tools. This is about secondary use of health data, of course.
Thanks, Emilie, for this great context. No, I think it was really important to remind to everyone what existed and also the goals that we had. And so, because I'm the timekeeper, I'm sorry. I have also to maybe deep dive into what you said, Emilie. You reminded all the European regulation existing right now, their aims, and in such a sum up of what they are made for. I wanted to have your POV, Jukka, from Finland's perspective. How do you implement at a national level in Finland, for example, because some of them can know a bit about France, but let's talk about Finland. How do you involve the stakeholders? How do you implement this?
Yes, of course, the implementation of the AI Act is ongoing in Finland at the moment. And in Finland, we are actually dividing the responsibilities of the AI Act into the different subject domains. And I feel this is important, but because it makes it possible to build joint processes on the AI Act and medical device regulations together. It makes it much more easier for the developers. And as Emilie said, the main challenge here is that when we have the European regulation and plus the national regulation, it is so overwhelming. It is very difficult to understand what is possible. And that, of course, slows down the development. In Finland, to cope with this situation, we are now building our national guidelines on enabling interpretations of this legislation. And later on, we will also change our national laws to make it easier to utilize the AI in health.
That's great. So, as I can say, there are some differences, but also some ways of working at the national level that are the same. So, speaking about implementation, but maybe about governance, Randy, I wanted to have also your point of view and how Norway governs it. Like, what are in France, as a French, we speak about administrative burden a lot. So how is governance in Norway in these regulations?
Well, first of all, thank you for having me here. And we brought a gift, Jukka and me, from the Nordic. So you can see that it's snowing all around us. You're welcome. So the AI Act is also being implemented in Norway, even though we are not a part of the European Union, but we are a part of the European Health Union. The government has launched a joint AI plan for health, and the plan is for 24 and 25. And it's led by the Norwegian Directorate of Health, together with the health regions and the municipalities. So we bring along the stakeholders all the way from the beginning. The vision is to have a safe and effective AI use to strengthen health and care services, to improve the workflows, and to build trust among those working in healthcare and the patients. The goal is to ensure safe and ethical use of AI to enhance the service quality and to free up time, because as elsewhere in Europe, we don't have enough health personnel in Norway. Also, it's important to promote sustainable development of health services. So I have lots of notes, but we are running a little bit late, aren't we? So what I wanted to say is that we are creating, because normally in Norway the governance is not very strong. We are giving a lot of autonomy to the health regions and to the municipalities. But when it comes to AI, it's important to have a strong government, we think. So we are creating this National AI Council for strategic advice. And we hope that this stronger government will give more equal health services when it comes to AI across the regions. And also, as the same as in Finland, the Norwegian laws are being adapted now this autumn to make it easier to use AI.
Interesting. So governance, so you give to the region their autonomy in a way so far in different aspects, but you said like AI has to be a government matter.
Yes, because in Norway we have more than 300 municipalities, and you know that we are not even 6 million inhabitants. So some of the municipalities have like 200, 300 inhabitants, and the librarian is the same one doing the AI implementation. So of course you need more help from the government.
And so maybe if we want to deep dive a bit on practical use cases that could be, because we're speaking about like the plans, the governance, but what are the concrete actions that are led right now? For example, in 1 minute in Finland, what are you doing right now? Some use cases on implementation and adoption for people to follow up on this and follow the governance.
Well, this is impossible question because so much is happening and AI is everywhere. But I give you 2 user cases. The first one is that we have very positive experience on AI doing the entries into the patient record systems based on the conversation between the patient and the doctor. And the potential is here huge because it can take up to 2 hours per day for the professionals to deal with these kind of administrative issues. The second example is quite different because in Finland we have worked quite a lot with this secondary use of social and health data. And nowadays AI is actually helping our National Data Permit Authority, FinData, to anonymize the data sets before they are delivered to the data scientists. And this is also a good example because the manual anonymization is quite resource-taking.
Okay, and in Norway, is this like something existing also? I saw in your preparation you talk about radiology, for example.
Yes, we have implemented, we started a few years ago to implement radiology or AI in a radiology service in one hospital in the southeast of Norway. This service is up and running now and it's a great success and we are saving like thousands of working hours every year due to this service. And in addition to that, in another health region in the north, we are starting now as an implementation strategy which is completely different from the one being done in the southeast, because now we are going to implement AI in the radiology and in the administrative services throughout all the hospitals in the entire region. And I can't say anything more because we don't have any results from this, but it's just an example on how we are trying out different strategies. Because it's all new, nobody has done this before, ever. So we just have to learn from each other and try.
And speaking about like learning from each other, maybe an example from France. Could you share like an example of a concrete EU members collaboration on specific topics that you could have?
Yes, maybe in a quick words. Of course, we are like you, experimenting the development of AI tools. So our French Health Ministry tries to accompany this use, and some of my colleagues are working very hard on this topic. But just to make a quick highlight, maybe on an initiative led by our colleagues from the French Health Data Hub, who were leading a consortium of 17 organisms across Europe to start to prefigurate the future of the collaboration between all the health data access bodies that are provided by the European Health Data Space regulation, making it possible to share data within several European countries and exploring several use cases, very concrete, of secondary use of health data. I'm sure my colleague Emmanuel Bacri have told about it this morning, and some of you here have heard him. But for example, it make it possible to try some use cases about COVID-19 testing, hospitalizing and vaccination in vulnerable populations, for example, sharing data from several countries in Europe. And this is just a very tiny glimpse of the tremendous potential that is offered by the data sharing promise of ESGS regulation.
Right. So I think that, as I heard, there's a lot of national initiative, but also made in an European also level. So the thing is that the European regulation is for all in a way, but each country has its own regulation, but work with others also to learn from each other. And I think that's also a great message. I will ask you a little challenge, maybe to close up this roundtable. How do we move forward with adoption in health system? Like, from all your experience and the collaboration you had, what are the key lessons that you learned from your country experience, and what steps, in your opinion, should be taken to facilitate smoother adoption across Europe? It's a challenge in 1 minute. Maybe Randu, Jukka? Randu, let's go.
D'accord. Well, we see, first of all, that we need a stronger governance to manage AI properly. And the Norwegian model for autonomy and things like that, it may give equal health services. And another thing, which is a very important thing to be able to implement AI across Europe and across the nations, is to build down the silos, because the healthcare system is really built up by these really strong silos, and we have to take them down.
Jukka?
Yeah, we launched our national ecosystem on health AI just before the summer, and now there is already more than 200 organizations participating that. And the key lessons learned there is that really this kind of a public-private R&D organization cooperation is needed there. And second learning, and even more important, is something that Randu, you already said, that you just need to start developing and using AI to gain results. And now about the future, as we now have our national ecosystem more or less up and running, we are very much seeking for international collaboration in this area. So if you are interested, please come to talk to me or ping me afterwards.
And Emilie, what will be your last message, the key message on this?
Thank you. Just a few keywords, maybe. First, maybe fundings, because it's also a challenge to get to finance all the transformation that are needed at national level. So we expect a lot from the European Commission fundings, to be really honest. Second, maybe raising awareness among the stakeholders, among the healthcare providers, healthcare professionals, and patients, of course, and citizens in general, because all of these regulation will never apply in any of our countries without the trust. And this is really important. And we didn't talk about the rights of the person, for example, but it's also a very important challenge. And it's really necessary to have a real trust in the system if we want it to work properly.
So it will be a multi-level collaboration, a trust in an ecosystem, working between countries, and I think that you nailed it for the challenge I gave you. Thank you very much, and I think we can give them a round of applause. Thank you for being with us.
Thank you.
And feel free to connect with each other because we heard a call to collaborate with different countries. Don't hesitate. France, Finland, Norway, and all other countries, we need you.